You are listening to a recording from the 2021 PM&R Scholars Virtual Residency Fair. We would like to take a moment to thank the residency programs who have taken the time to present at our fair this year. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap, the best resource for your physiatry clinical preparation, audition rotations, board preparation, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and even oral board cases. Head to PM&RRecap.com to learn more.
All right, so really excited to have everyone here tonight. So we'll be talking a little bit about our program overview, and then obviously we'll have time for questions at the end. So UW PM&R Residency is located in Madison, Wisconsin. We're an advanced program, which means that we do 3 years of specialty training here. And then most residents will do a preliminary year or transitional year, either locally or somewhere else, and then come here for the remaining training. We take 3 residents per year, so we have a total of 9 residents in our program at any time. We also have a pain fellowship here, which takes 2 fellows per year, and we can talk more about that at the end if anyone has questions about it. So we're fortunate tonight to have both Dr. Poliak and Dr. Sewer on to answer questions as well. So Dr. Poliak-Tunis is our program director. She specializes in pain medicine, works primarily out of our pain clinic and procedure center. So we get to spend a fair amount of time with her on our pain rotation. And I can say without a doubt, she brings a ton of energy and enthusiasm into our program. So I know all the residents love working with her, and she's constantly been improving our program overall. Dr. Sewer is our associate program director. He also specializes in pain medicine and works out of the spine clinic and procedure center as well. He's done a ton of work with the medical students and has really helped to boost their curriculum and improve their rotations overall. Our program coordinator is Delilah. She also does the coordination for the pain fellowship. So she's doing 2 jobs at once, and she works really hard, and our program would not function without her. She's always really organized, staying on top of things. So we really appreciate all the work she does. So our residents, like I mentioned, we have a fairly small program. We have 9 residents total. That really helps with making sure that we really get to know each other very well. I think one of the unique things is that everyone really gets along very well and fits in with that small town feel. So we're basically a second family together. We spend a lot of time outside of work together as well, especially pre-COVID. So I've really enjoyed that part of the residency experience overall. Our faculty here is also phenomenal. Everyone has a wide array of interests, including pain medicine, cancer rehab, neuro rehab, spasticity management, pretty much anything you can think of. The nice thing again about being a little bit of a smaller program is that we really get to work one-on-one with attendings and have a lot of hands-on experience. We get to tailor our rotations individually, so we can create kind of what goals and objectives we want to help with our future careers. So our rotations are a mix of inpatient and outpatient throughout all 3 years of your residency. So one of the things about our program is we don't front load our inpatient experience, which I think is helpful not only to prevent burnout in the beginning, but also ensures that you're constantly getting that reinforcement of the inpatient education, and particularly helpful for boards or if you want to practice inpatient medicine when you get out. Our rotations are typically 3-month blocks. We also have some 6-week blocks that we're doing as well. So UW Hospital is a level 1 trauma center, also a comprehensive stroke center. We have 505 beds at the main campus, and it's ranked the #1 hospital in Wisconsin. The rehab hospital that we work at is a standalone rehab facility. It's 50 beds. It opened in 2015, and we take a variety of admissions there, including stroke, brain injury, spinal cord injuries, amputations, orthopedics, and then debility from any medical complications. So when you're doing your inpatient rotation here, there's no specific services per diagnosis necessarily. So Generally, when you come in as a PGY2, you'll take a little bit of the simpler, more straightforward orthopedic cases as well as strokes. And then as you progress through your residency, you'll pick up more of the medically complex patients and spinal cord injury patients. Our pediatric rotation takes place at the American Family Children's Hospital, which is connected to the main UW campus. It's also a level 1 trauma center and highly ranked among the other children's hospitals in the US. We do have an inpatient rehab unit located within the children's hospital that we take on a variety of inpatient cases. The consult service in the pediatric hospital is quite robust. We are consulted on all pediatric traumas that come in, and then we screen them to see which ones are appropriate for rehab consultations. In this way, we're able to really capture a wide variety of kids that might need some rehab management. So ranging from mild concussions to patients who have had very severe traumas, and really making sure that they get the rehab management they need. And then some of them end up coming towards our inpatient service as well. In terms of outpatient clinics, we have a variety of multidisciplinary clinics that we attend, including cerebral palsy clinics, spina bifida, and then learning how to do Botox procedures on pediatric patients as well. So the Central Wisconsin Center is something very unique to our program. It's a facility that provides short-term and long-term care services for intellectually and physically disabled individuals. So we spend a total of 3 months here, and during admissions that we do for our short-term residents, it's a really truly multidisciplinary team approach with not only therapists there, but we have dietitians, pharmacists, psychiatry, even audiology and dentistry. So really trying to provide comprehensive care for every patient that comes in. There's also a repair center right on site so that anybody who needs in-house modifications for orthotics or wheelchairs or other equipment can be done while they're staying here. And as a PGY 3 and 4, we have opportunities to moonlight here on the weekends. So the VA hospital is also right next to the UW main campus, and we do 1 rotation here during an outpatient clinic rotation. And the provider we work with does mostly spine and musculoskeletal work here. He also helps lead the comprehensive pain program that helps with weaning opioids and intensive psychotherapies for multiple patients. And there's an amputee clinic here as well that we go to several times a month for new amputees, as well as managing prosthetics for older amputees. So our outpatient rotations take place at a variety of clinics across Madison. So the Middleton Rehab Clinic is primarily where we go for general rehab and our neuro rehab rotations. There's the Research Park Spine Clinic and Pain Clinic where we do our musculoskeletal rotation, spine clinic, and our pain rotation. The Madison Surgery Center is where we learn how to do all of the interventional spine procedures. And then the American Center is the hospital located actually right across the street from the rehab hospital over on the east side of Madison, that we have a lot of our sports medicine rotations, musculoskeletal clinics, and spine clinic is located there as well. So our didactics take place every Friday from 8 a.m. to noon, and we cover all of the high yield board relevant topics. We also have additional didactics that occur on certain rotations, such as inpatient, where on Thursdays, a therapist will give a talk, and then every Tuesday, one of the hospitalists will give a talk as well. We also do several resident-led didactics. So we give several journal clubs over the course of our residency, in addition to clinical case conferences, M&Ms, board reviews. And then as a PGY 3 and 4, we do grand rounds presentations for the entire department. So another strength of our program is the number of procedures and exposure that we get to hands-on experiences here. So we really learn how to do Botox injections, ultrasound guided injections, fluoro guided spine injections, EMGs, nerve conduction studies. So These are our average numbers from our graduating class from last year, and we far exceed any of the minimum numbers needed to graduate per ACGME. So definitely heavy on the procedures, and I think all of us feel very comfortable doing procedures when we graduate. So our call is home call, and it's divided into a primary call and backup. Our primary call is basically starts on Friday night and ends on Friday morning the next week. And the requirements are on the weekend, the primary resident is the one that goes into the hospital, the rehab hospital, and does the admissions for the weekend and sees most of the inpatients there. And you do 9 weeks as a PGY2, 6 as a 3, and 3 as a 4. And then during the weeknights, the resident will cover the pager overnight if any issues come up. There's also a backup resident that will go in on the weekend and see anywhere from 10 to 15 patients in the inpatient rehab hospital, write the notes, and then is done for the day. So it has no pager responsibilities and does about 6 weekends per year throughout our residency. And that's primarily designed to help offload the primary resident when the census in the rehab hospital is higher. And then I also just included basic information on how many vacation days we get, conference days, sick days, and then salaries for our residents over the past year. We also get an education stipend of $2,000 to use towards books, conferences, anything education related. And we have memberships to both AAP and AAPM&R during our residency. In terms of research, this is just a list of some of the topics that our residents are currently doing projects on. We have a variety of different things, including radiofrequency ablation studies, Botox, osteopathic manual therapy use. And every year we have several residents going to conferences to present on these topics. And then finally, I just wanted to give a little bit more information on Madison itself. So Madison is the capital of Wisconsin. It's the second largest city in Wisconsin, and uniquely is one of the only 2 US cities that's built on an isthmus. In terms of things to do here, there's a ton to do year long, especially when it comes to outdoor activities. Madison is a very outdoor friendly city. So there's lots of biking, hiking, water sports, running trails, pretty much anything you can imagine. In terms of entertainment, almost every weekend, particularly before COVID, there was always a festival going on in Madison, concerts, new bars and restaurants opening. So essentially you can find anything to do if you're interested in it. And then fortunately for Wisconsin as well, over the past few years, if you're a big sports fan, there's been tons of events and exciting things to watch as well during that time. And being part of UW itself has been really beneficial because a lot of the residents will go and watch volleyball games, football games together, and it really helps bring the spirit of being a true part of the community here. So that is most of the basic information we have. We do have an Instagram, so you can follow us at UW-Madison PM&R to know what we're up to. We also had another meet and greet occurring next week on the 19th. So if you'd like more information on that, to ask us more questions about our program and whatnot, you can feel free to email us to get that information. I also put all of our contact information up here, so feel free to email us with any questions. And I did want to leave enough time for questions, so I'll turn it over to John to answer any questions that have come up.
Got about 5 minutes left.
Hi there, I'm John. Hopefully you can hear me. I'm one of those third years. Somebody asked about biking, very biking friendly. I don't think any of us are dedicated enough to truly do that at this point, but I know of a student who has biked. So biking friendly. Let's see, what community engagement and or sports coverage opportunities are residents involved in? As far as sports coverage, Dr. Sewer does cover football, high school football at a local college. So I'm at local high school, so residents certainly have an opportunity to rotate through that on one of the weeknights as well. So that's certainly available. In terms of community engagement, we do have a community rotation dedicated to seeing more specific community-based programs, such as, for example, how to evaluate a person in terms of driving, adaptive sports. That was put on a slight hold, to be honest, during COVID, but I anticipate that will be something that will be rising up in the future. Let's see here, I'm trying to get to all the questions.
I'll pop in here real quick and mention the
Yeah.
sports stuff.
Yep.
So yeah, I've been covering DeForest football and wrestling for the last like 6 years. And I will be having that position for years to come. So we have that, one of the big perks is that since I'm there, any resident can come over to any of the football games, home or away, wrestling matches as well. And once you do that, we actually have coverage for the state championship stuff as well. So football, wrestling, basketball, track, tennis all come through UW. And they allow basically anybody who's done any kind of coverage to cover those as a UW sports med person. So in addition to that, there's 1 marathon, 2 half marathons, half Ironman, full Ironman that we can all cover if you'd like to hang out for any of that stuff. So we've had various residents do some of that stuff over the years. CrossFit is in town. Matt Cowling, one of our now Pain fellows, used to cover that, but we don't have anybody covering that now. So yeah, there's a ton of opportunities for sports coverage. So if that's your thing, you basically have an in right away when you get here hanging out with me on the DeForest sideline. And not to brag, but we are the defending state champions. So we're pretty good. What was the next question you were going to answer, John?
Any rotations dedicated to research? We don't have a specific rotation just for research. We do have elective time that you can use for that for 3 months, but we do have a research program set in place where we, right when you come in, we try to pair you as a second year, a third year, and a fourth year on a research team to kind of have a longitudinal project in place. And we also have dedicated time during didactics to kind of talk about our research projects and hash out anything that might be that might need to be talked about, basically in terms of pushing the research forward. So just to recap, no dedicated rotation, but we have set aside time and specific didactics and such for research.
Yeah, and to piggyback on that, we've had one of our residents who just graduated who is a big time researcher. And I'll tell you at UW, and this will cycle back around to the next part about favorite part about being in Madison. From a work standpoint, Madison is one of those places where anytime you're willing to come up with an idea and reach out and ask somebody for help, there's always someone there who's willing to help you out. So I had a project that I was working on. I had no idea where to start, but I just had an idea. I reached out to one of the biomedical engineering professors. Within about a day and a half, I talked to 3 people and they had me plugged in with a team of like 4 or 5 different medical undergrad students who are working on it. So one of the best parts I would say about working in Madison is the congeniality that goes along with it. I've never been yelled at by a surgeon yet. Everyone's super nice. They're very helpful. Paul Anderson, who's a spine surgeon for 30 years, pulled me aside and was super engaged in my during fellowship, and even when I started, just teaching me, kind of holding my hand, pulling me along. So that was wonderful. As far as just Madison in general, there is so much stuff to do here, no matter what your hobbies are, whether it's water sports, running, biking, art, shows, things like that. There's always stuff to go do. If you're a huge foodie, we had a resident who was a huge foodie from New York City, and he was not disappointed at all by the food scene here. So we have something for everybody here. Honestly, it's an easy place to live. Everyone gets along really well. It's a safe city. So, I mean, I don't really see many downsides about living in Madison. Plus, Michelle Poliak-Tunis is here, and you can't beat that.
And behind me is Madison. Obviously, it's a virtual background, but yeah, I agree with what everyone has said. I'm not originally from here, but I've been here now for 7+ years, and it's a great place to train. It's a great place to raise a family. It's a wonderful working environment. We really are like a family in our department. So we'd love to have you guys join our virtual meet and greet in next week, which will just be the residents. So you won't see myself or Michael. But I really want to know we're probably cutting on time, and I'm sure you're going to cut us off now. So
Yeah,
I just
sorry,
want to
think
say
that's all we
thank
got
you.
for
No,
guys
I know.
today.
Perfect. Thank you. Thank you so much, PM&R Scholars. It's been great. Thank you.